Well, the launch of the model plan to deliver services to rural communities by the President in the form of an Imbizo with locals in LusikisikI in the Eastern Cape is currently happening today. And we're told this is the first pilot site of the district-based coordination model dubbed Khawuleza, or Hurry Up. This is basically to speed up service delivery. And Busisiwe Jemsana-Mantashe is covering the story for us. She joins us now live. Busisiwe, thank you very much indeed for coming through. What are you witnessing this morning?
Very good morning, Blaine. As at this moment there is a stakeholder meeting where the President and his cabinet, various mayors and government officials are meeting to discuss the program of the day and perhaps how best to outline the program of today. Where we are coming to you from, we are outside the NHI pilot clinic. It would seem, Blaine, that it is one of those that they would mark as that good story of service delivery, as this is the state of the art clinic. It is aimed at producing or rendering the world-class health to patients in and around LusikisikI. Before this state of the art clinic, this clinic did not have any waiting areas. It was deliberated. It was in a state that was one of those that were not really intriguing, that sense of that there is a health facility where people are free to go and they hope that they will be getting the service that they want. It was then refurbished, and now it is one of those state of the art. But more than this, Blaine, what the provincial government has been talking about is the attitude of nurses, and therefore they're saying they're now working on providing more nurses, hiring more nurses to deal with the shortage of nurses in public hospitals, so as to deal with the attitude of nurses, because more often than not people complain about the attitude of people who are receiving them in public hospitals. So this is a pilot project, and hopefully it will be also extended to other areas. Later on, the President will officially launch the Khawuleza district model that is aimed at making sure that government departments do not operate in silos, but there is an integrated approach in trying to fast-track service delivery. Over the past couple of months, Blaine, the province has been plagued with a number of service delivery protests where residents are complaining about the lack of service delivery in their areas, and this would be then maybe the answer to those service delivery protests, as they have not been getting the services that they want. Now this model seeks to make sure that government entities, two local government, work together to fast-track service delivery. As we speak, Blaine, here in the OR Tambo district municipality, in some areas there is no water at all. People are queuing for water. The roads are in a very bad state, and a number of service delivery grievances that range from refuse collection and so on, and housing across the province. So residents really hope that this will be the answer to their plight and their concerns over service delivery.
Well, let's speak about that. You mentioned some of the challenges that are facing the residents there. Are they optimistic? Obviously, the President has to break down this model, exactly how it works. My understanding is that it's aimed at tackling the triple challenges of poverty, unemployment, inequality, but also, I guess it's the synchronization of all spheres of government, also working with social partners as well as business and the community. So are they hopeful in terms of this model?
Well, Blaine, there are various views that people are expressing. I can tell you the President will have a tough time convincing those who have lost all hope in ever getting the services in the government, from the government, especially in the OR Tambo municipality, the rural province of the Eastern Cape and the rural town of the province, where they are saying that they've heard all this before. They've listened to politicians making promises. They've listened to all this before, and they're not really hoping hopeful that this will bear fruit. But some are saying that for the fact that he is here because he arrived yesterday, that brings some sort of hope to them that something will be done and that he'll be able to make sure that those who are below him, provincial officials, local government officials, will toe the line should the president really give them the line that they should toe moving forward. So it's different views of those who have lost hope and those who are still hopeful.
Yep.
And it is yet to be seen how he outlines his program of action moving forward, and if that really brings hope to those who have lost hope of ever getting services from the municipalities at local government level.
Yeah, so I see that the launch is happening at 11 o'clock at the Zalo Hill Sports Field. Still going according to plan?
As far as we know, Blaine, we are still also monitoring that program. As far as you know, it is supposed to start at 11. Of course, we are unable to confirm now as they're still in a locked-up meeting with cabinet, with the president, officials, municipality officials and the mayors discussing a way forward. We are still holding them to that program that it will start at 11. But before that, we're expecting the president to come and do a walkabout in this health facility with the Minister of Health, Dr. Zweli Mkhize. So it is yet to be seen if they stick to the times and everything goes according to plan. But as of now, we are still waiting, Blaine.
All right, Busi, we'll try to check back with you in a short while. Thank you very much indeed for your reporting. Busisiwe Jemsana-Mantashe coming to us live from the Eastern Cape.